the 5 megahertz and the 8 megahertz probe is sufficient to be a very good screening tool. So beyond this, I don't think so you need any other time. The companies do give you up to 10, 12 megahertz probe, but 5 to 8 is what we use generally. So this is how easy it is to go along. Before it was once a typical vascular surgeon's kind of a tool which all vascular surgeons used to know. But now I see all podiatricians carrying this, and I'm very happy to see this, because it's one of the best important things, and you can go back to the bedside and do the Doppler studies. So what are we measuring in this? So you measure the ankle brachial pressure index. So basically, I always say measure both sides brachial artery pressure. Choose whichever is the highest. Never go with one side brachial pressure, because in atherosclerotic disease, you know, some people may have their subclavian and the BP might be low at all. So always measure both sides brachial and choose the highest. And ankle systolic pressure. Choose the dorsalis pedis, anterior basically, with the ankle brachial pressure, and choose the posterior tibial, and whichever is high you can choose, or you can take the mean and then you can use it. Sometimes you should also think about variance. You will not be able to see the anterior dorsalis pedis and all that very clean, but one vessel, make sure you need to measure. Okay. So procedure for carrying out an API pressure. It's a very important step which I think that all of you should follow, because though it might be basics, but I feel that this is very important. Ensure equipment is a good working order, okay? Because it's very important. This is very, very important. The patient should be as comfortable as possible when doing this test. Don't be in a hurry to do all these tests. And make sure you palpate these pulses first before putting on the Doppler signal, right on the patient. Okay? And make sure you place your sigmoid cuff on the arm and proper, and I hope that you all follow the same, how the tube has to be aligned along the artery, and all these things, and use gel in our benders. Don't be very thing about using the gel. The gel is very important in the conduction part of it. And this is another important thing. Never keep the probe ekdam perpendicular. Okay? Towards the flow. Now you've got bidirectional flow. Earlier the company used to bring out only with the flow. It only had biphasic flow and a single flow. That time you need to be very careful. So always hold it at 45 to 60 degrees to the artery to get the maximum benefit, because you're dealing with arteries, not normals, which are abnormals. Okay? And inflate the cuff until the signal disappears. Don't keep on. Never have the habit of inflating it to 140, and then you slowly decrease and do it. It's not like that. That's what the systems do. But once you keep the signal, you got the signal, then you inflate the pressure, and once the signal disappears, you have to mark the signal. And I would generally say at least repeat at least one more time, because it's always better than you repeat one more time. And okay, inflate the cuff and the signal disappears, and yeah, these are the few things I think you can just read it out. Okay, and then you will have them all this. This is one thing which I would say leg over arm. This ankle systolic pressure by highest brachial pressure, and this sort of calculation, I think, of calculation that we do. So what is the ABI? Like 1 to 1.3 is considered normal, and these are the normal things. I think generally when it's above 1.3 thing, there is always calcification, and our diabetic patients are very happy with calcification. You would have a rate of 1.3. It doesn't mean that it is normal. These are the cases where I would say go in for a color Doppler to see whether it's matching with the diagnosis. Factors which can affect accuracy is patient's actions, explain the patient what I'm going to do, very important. Incorrect gel or incorrect positioning of the patient, incorrect size of the cuff, incorrect the Doppler probe size. These are quite standardized now. You don't tend to make obvious mistakes now. So I think if you get the correct thing, you do it. And the sphygmomanometer, definitely do not release very rapidly. Be very slow how you're releasing it. And prolonged inflation, I try to avoid this because it can cause hyperemic effect on the limb. So only when your Doppler thing is ready and you're ready to do it, never inflate it and then start searching for those things is going to be a problem. Okay? I think the learning curve is not steep, learning curve is quite good, and try always to do with normal patients, keep trying, and always try to listen to the sound. And you also get to print out, but listen to the sound how it is. So these are the few things which I would like to combine. These are the areas where you might have difficulty because some patients will have excessive pain, cellulitis you will not be able to do, and big swelling. You obviously cannot do it. Send them directly for a doctor's care. So finding the PODO, I did not teach the podiatrician how to look for the vessel, and all that. You can teach me better than what I can say. Fine, now interpreting the sounds. So, yeah, this is a triphasic wave pattern, the systolic component, the diastolic component, and then you get the reversal up on the positive side. This is very important, this is a very classical triphasic. This sound, if you hear it for the next note, you can say this sound. This has to be in your mind. This has to be there. Okay. So this will say it's a normal artery, good arterial compliance, no significant vascular disease. We'll go to the next one. So this is biphasic, where you don't see the upward forward flow and it stops there. So you've got a printout also which the machine gives, and you can also hear the sound wave how it comes. Can you put on the sound please? It will be like and it stops, it doesn't go so this indicates that it's a biphasic wave pattern. Early atherosclerosis and early PA. So this is the information that we can give you. The next one is the monophasic. So you can hear it this way. When you hear it this way, that means there's a good amount of collateral circulation. There's a block. There's a good collateral circulation which is forming. That's why you get. Sometimes you get a thumb throb. If that happens, that means a severe peripheral resistant, severe calcified vessels, and these are two types of monophasic wave pattern. Okay. So if it is there, then that means these are the cases where you need to go for other investigations, right? So this is monophasic. And I said to you, this Doppler machine does not have, you don't know where the waves are coming. So it can be superimposed with the venous flow. The venous flow is continuous. It will be like a wind blowing into here. So these are things when you know that the artery has to be somewhere close by, you adjust the probe, then you can do it perfectly. So these are the common things that you will get always. So now, let us see some of the case examples, like 45-year-old, no diabetes, no smoking, no medication, triphasic. One more thing is, if time permits, I would always say, go from the common femoral artery, do the popliteal artery, do your dorsalis pedis and your posterior. That will give you the best way of comparing where the obstruction is, where the thing is. Directly, generally for ABI is not necessary, but you want to be more specific to see where the obstruction is. These are things which I would say. And generally nowadays, all the vascular surgeons do this, and I think all podiatricians need to follow this. And they say this is normal. Right? Next, one more example is, you've got a triphasic here, you've got a biphasic, and the posterior dorsalis pedis. So it means you're saying that the ABI is 0.9 or 0.0, still you can go ahead with your treatment process without going in for higher investigations, unless you feel that there's a delay in bone healing or whatever, then you go for other things. So this is a mild disease which is there. So when you have biphasic, monophasic becomes definitely an abnormal time. Definitely the patient needs to have a Doppler or an angiogram. It is a controversy with CT and that I'm not going to go into, but yes, he definitely needs another investigation needs to be done. So, see, this is the advantage of getting where the disease is. You've got common femoral artery and triphasic, popliteal artery becomes monophasic. That means you know that the disease is going to be somewhere in these two areas. So you know that there is a superficial femoral artery disease. So the more you do with all this, and you'll be more convinced, you'll be talking to the patient more clearly, saying, yes, Bob, this is where the problem is. And I agree, the same thing. You know where it is, the CFA is monophasic. So this is a rough table where one wants to see, you've got a common femoral triphasic, normal, immune disease, becomes monophasic, here it becomes more and more. It's just a rough example to show you. And a very practical rule in the clinic setting is always go from common femoral popliteal posterior dorsalis pedis. learn the habit, keep going on this habit, that will make you more precise. So with this, I think we can go with the workshop. We'll just show you how we're going to do. Perfect. Sarat, okay. Assuming the Sarat's BP is already measured in the hand, I'm not going to teach you how to measure BP in the cuff, so assuming that Sarat will be normal. So assuming that the BP is normal, 120 calculus, it is to have. So now as you feel, you've got it's not like the keratins, you can feel both the pulses. Okay, good. Perfect. So for the dorsalis pedis, if you extend this toe, there's extensor hallucis which comes, and just lateral to the extensor hallucis is where you have to keep the toe. But you keep the same. There's something when I don't get it. You need to keep it. Let's try to show the first the sound, because it doesn't have the habit of doing the sound. Then angulate the probe towards side. Okay. The other way around is again, now the machines can pick up biphasic, but always trying to go, the flow is coming this way towards the flow so that the sound is much better. So once I get this, then you tie the BP cuff, and then you inflate it. Can I just tie the BP cuff? Just to show that it occurs at this point and if your clinic is too busy, teach one of your physician assistants, they'll be able to do it. Because, but it's happens as 130. So if you put the 130 by 120 the rule, assuming that the blood pressure is starting is okay. So that should be more than 0.1. So same thing you do again for posterior. So if you want me to show the posterior? Yes. Okay. See landmark for posterior. See for the dorsalis pedis I already said, go from the interdistal space, just lateral to the extensor hallucis tendon, and from here you can start. And then you can go towards the most prominent bone. You will definitely feel before that. If it is not there, that means it is not going to be there. Now the other thing is, when you go for the posterior tibial, make the patient lie on lateral malleolus, and then gently. Never forget these basic steps. So roughly this is what is Podiatry and yeah, fine. So I think this is how it is. So if any else has any questions to ask, you can ask. Thank you.
Thanks a lot, sir. Thank you.
Thank you, sir, for the informative session. Now I request Dr. Nellayapar to felicitate the